Warm greetings to all the dignitaries and judges present over here. Today, my topic for the poster is Reconstruct, Restore, Revamp Function and Aesthetics. The case presented over here includes a maxillary hollow bulb obturator. Oral cancers involve cancers of the tongue, lips, floor of the mouth, hard and soft palate, sinuses, and pharynx. The cancer of the oral cavity developed due to squamous cells found in the mouth, lips, and tongue. Squamous cell carcinoma accounts for around 65% of the oral cancers. The cause of cancer for this patient is squamous cell carcinoma. The patient had a history of a small ulcer in the palate. The patient had visited a dentist at a private clinic. The patient was prescribed multivitamins for over a week. The patient reported to the dentist after a week. The ulcer had not healed and the pain had also not subsided. The dentist has suggested a biopsy for the patient. A biopsy was taken for the patient. The biopsy report revealed a cancerous growth in the palate. It was revealed as squamous cell carcinoma. The patient was referred to a hospital for treatment. The oral surgery department and the team of prosthodontists examined the patient. The ulcer was around 2 to 3 centimeters. The patient's history revealed that he was a smoker for around 30 years and had quit it a year ago. The surgical team had checked the extent of the lesion in the report, and afterwards the surgery was decided for the patient. The extent of the lesion was from the midline and it had extended till the palate. The surgical team had approached the case in this way. The teeth in the line of radiation was excised, and after which the surgical excision was done for the patient. Following this, the radiotherapy was also done for the patient. After excision and radiotherapy, the patient was asked to report to the Department of Prosthetics for rehabilitation. The extent of surgical lesion was classified as Armani Class 1. An interim obturative was given for the patient for the tissues to heal and also for these scar tissues to completely heal and for the scar tissue to form in the area of the lesion. The patient was called intermittently for a period of 6 months, and the extent of healing and as well as the scar tissue formation was examined. After a period of 6 months, the patient was called from a definitive obturator. The patient had opted for a definitive acrylic maxillary hollow bulb obturator. The patient's treatment plan was as follows. The primary cast was done for the patient, following which a special way was fabricated. After that, a master impression was taken, and then the occlusal room was fabricated for the patient. The jaw dilation was carried out for the patient, following which the cast was articulated and the wax tying was also done for the patient. Then the denture was processed and the patient was called for insertion. On the day of insertion, the denture was inserted and all the occlusal interferences were trimmed for the patient. The patient's speech and aesthetics were also checked on the day of insertion. The patient was asked to report after a week for review. After a week, when the patient reported for the review, the function and the aesthetics as well as the difficulties which was there in the denture was examined, and all the interferences, any difficulties in the denture, any any ulcers or any sharp points which was created because of the denture were trimmed. The patient was also called for review after a month. The patient was asked if there were any difficulties. The patient had said that he was very happy with the denture and he was also able to perform his functions very well, like mastication. The patient was able to also socialize very well because of the new denture, and he was also very happy with the aesthetics. So the patient had finally recalled after 6 months and after a year also, and the patient had no complaints. He was completely happy with the aesthetics, with the function as well as the aesthetics and the smile as well as the function of the denture after a year or such processes give a new lease of life for patients who have maxillofacial defects and help them to overcome the social stigma created by our society. I thank the organizers of IPS for giving us a wonderful opportunity to present our poster. Thank you.